You are tuning in to Living Mentally Well with Kevin Hines. Follow us as we interview some of the greatest, most influential minds and public figures in the fields of suicide prevention, entertainment, activism, mental and behavioral health. We welcome you to listen, learn, watch, and enjoy. Watching Living Mentally Well with Kevin Hines, and we are here with the one, the only, the great David Covington, one of the greatest workers in suicide prevention and mental health that we have on this very planet. David, can you tell me what brought you to suicide prevention, and why do you care about it so much?
Thank you, Kevin, for those kind comments. I've been working in the mental health field for almost 20 years now, and the day that I took my exit exam from the University of Memphis, so that I would be a master's in community agency counseling. I was coming home. I'd just taken the 4-hour national council exam, and I thought my head was this big because I was going to have a master's, so that meant I was a master counselor. And I walked in the door ready to go out and celebrate, and I immediately got a call from an individual in his 50s with medical issues, isolated from folks. He was in my church, and he was calling somebody to say goodbye. And the very first thing I thought was not how can I help him or what do I do. My very first thought was, are you kidding me? I just spent 4 years going through a K-CREP accredited 60-hour program, and I didn't get 5 minutes of preparation for that moment. So over the course of time, I did a lot of work in crisis services and in mental health, and I found routinely that individuals did not get the preparation or the support to be able to do the work they wanted to do related to someone who was having thoughts of suicide.
Wow, that's... David, so you know what brings you to this field and why it's important, but what do you do every day? What's one thing you do every day for your personal mental health?
You know, I love to run. Being outdoors really gives me a chance to kind of think and create in my mind and kind of release. So that's I ran today down near the river, and that's what I do. So that helps me.
Exercise. If you can do it, do it. David, I want to know from your perspective, after being in these fields for mental health, suicide prevention for over 20 years, where do you want to see this space in the next 5 to 10 years?
So, you know, one of the key initiatives that we're really supporting relative to mental health is what we're calling zero suicide in healthcare. And it really is about the actually flipping that experience that I went through. So 15 years later, I was leading the Magellan Health clinical program for Maricopa County. We had a very large $750 million a year program, but nothing had changed. The clinicians that were in the network of providers that we work with, many of them self-reported that they didn't have the skills or the training or the supports from their organization to work with people at risk. And as a clinician, what I felt like was, one, that led to a lot of stress for them, but two, that probably led to very significant difficulties for those who were in their care, and more likely to be hospitalized, more likely to receive intrusive and costly services that weren't warranted, and more likely not to get the kind of engagement and support and outcomes that they all wanted. So really what we're focusing on with zero suicide in healthcare is for suicide care to become a central focus of health systems, of behavioral health, and for organizations to take that on as a priority bullseye, just like they have many other issues. Yes. To me, it's very akin to the work you've done with the Golden Gate Bridge. The Golden Gate Bridge has always saved lives. It's had trained security who would go out there, and they have, either physically or through a negotiation gotten people to safety. But it was also a very unsafe place. And it's just now, through your efforts and others, that the Golden Gate Bridge is deciding this isn't something on the periphery. No. It's not that we're about transportation and we're about tourism, and if we have to be around suicide prevention, we will be. They're deciding, no, they're going to undergird the entirety of that bridge with a plastic-coated steel safety net. Yeah. And to me, that's a great metaphor for behavioral health. We have saved some lives, but we've been a very unsafe place to be.
Yeah.
and especially for people with bipolar disorder or schizophrenia or major depression. And we're seeing health systems like Centerstone, like the Institute for Family Health, like in Haste from the Netherlands. These organizations, Hal Morton Hospital System in Christchurch, they're saying, no, we have to do the same thing the Golden Gate Bridge is doing. Programmatically, we have to find a way to undergird the entirety of that bridge. And so we're working together to create an international learning community to think through, how do we do that? How do we move it from the periphery to the bullseye so that staff get the support they need? And we as an enterprise are bringing all of our resources to bear to save lives. This isn't innovation. Healthcare systems and American business and international business are doing these principles every day to improve very complex problems, whether it's inpatient falls or medication errors or hospital-acquired infections. All things that at one time or another we felt like, well, we can only achieve so much with them, but then we began to put our enterprise to bear, our electronic health records, our protocols, our systems, and began to use data to define the issues and make progress. And we'll do the same here.
And work on the whole human being as opposed to just what's in here and not what's up here.
I joined in January Recovery Innovations and became their CEO and president in January. And one of the things I love about them is their mission is about that we equip individuals to through our environments and through our programs to find recovery, to achieve their goals, and to reconnect to themselves, to others, and to meaning and purpose in life. And I think as I've thought about that, I think that's the thing as I think about your work, Kevin, is saving people from the edge. It's important work, but then finding ways to go on to meaning and purpose and connectedness is really how we get to that whole person.
Yeah, getting them to go forward into continuous recovery. I had been diagnosed with bipolar disorder at 17 and a half. I've been in recovery ever since, in and out of psychiatric hospitals. You know this, David, and what gets me going every day, what keeps me on the move and into wellness as often as I can be, is the idea that I get to be alive. I almost died from a suicide attempt. I get to be here, and I'm going to work hard to stabilize every single day, but a lot of people help me. Tell me where someone can go online to look at your progress.
Right, so we have a toolkit that's available at zerosuicide.com, and then I blog and write on Zero Suicide at zerosuicide.org.
Okay.
Also, Kevin, we have a international summit that we are planning for September in Atlanta. We're hoping you will be able to join us. Looks like right now we've got about 10 or 12 countries that will participate, and our intention is to create an international declaration for zero suicide in healthcare and really fan the flames of this emerging social movement.
Amazing. And I think one of the things I learned, at least at this Congress, IASP 2015 World Congress, I think that I've gathered from certain individuals that we want to start by lowering the suicide rate by at least 20%, just as a starting point, and we can do it. It can happen. It must happen. It will happen. David, thank you very, very much. Appreciate it. All right. This has been Living Mentally Well with Kevin Hines, brought to you by 17th and Montgomery Productions. Thank you for tuning in. Subscribe below and let us know the thoughts you have in the comment section. Everyone has a story. We want to hear yours because you matter.